So first I'm going to show the management of the wheelchair. So first, the way you open and close it is you usually just grab the inside of the seat on the ends, and you're going to lift it up and make sure it folds. Okay, and then how you open it is you kind of want to spread it a little bit first, and then you press the sidebars on the seats, and then you just press down and make sure it does that little click noise. Next things are the brakes here. When you undo them, you want to make sure they're clearly undone, and then when you do them, you want to make sure it kind of does that like locking noise and shift instead of just going down there. Same things on this side. Next are the wheelchair legs. There's a little black lever here, which you push out and then you turn and lift it up. And then you want to fold them and put them on the side out of the way of an obstacle if you're doing a transfer, but also in a safe place so you can find them and easily reach them. Then how you put them back is the little holes here will match up with the little spokes here. You open this up and you line them up, make sure it locks there, and then you'll put them or slide it this way and make sure this locks and make sure it's in good position. If you need the arm or the leg rests adjusted, it has these little buttons here that you're going to press, and then you're going to pull down and make sure they come back out if need be. Same thing on the other side. You want to make sure the front wheels are well adjusted and out of the way when you're doing a sit to stand transfer. The way you take the armrest off is this one has a button in the front and then has a lever in the back. When the lever is facing towards the wheels, it'll be locked, but then when the lever is facing back, it'll be unlocked, and then you'll have to undo this one and then lift it up. And then to put them back in, you'll put them in the little holes here. Make sure you hear that little lock. Make sure that button comes out here. There we go. And then you're going to turn this lever back here and make sure it's locked there. Okay. And then, of course, that's on the other side as well. And then you have the armrest here, and you want to make sure you have a good grip over here as well. There's no bar back here, safety bar. I have the gate belt because we were practicing wheelies, which was unsuccessful. But other than that, I think that's it. For the wheelie portion of it, just for safety, you want to start off with the wheelchair locked. I'm not having my mom in this because I'm not going to risk her life doing this. So you want to have the gate belt attached to the wheelchair just for extra safety. And first what you'll do is with the wheelchair locked, you're going to have the patient lean back a little bit and you're going to put them in a wheelie so that they could start to find their sweet spot and try to stay there. And then the next one is you'll take the brakes off and you'll put them in the wheelie position and their hands will be at the very top. And they'll practice that to find the sweet spot so that they can balance there. But since this is a heavier wheelchair, it's kind of hard to do. Then after that, once they get good at that, what they'll do is they have to propel forward a little bit, and then they're going to go back. So they're going to wheel back a little bit. And when they're ready to do a wheelie, they have to lean back ever so slightly and then push forward really quickly and try to find that sweet spot in which I would be guarding behind with the gate belt and my hand by the armrest. Okay, so we're just going to propel on even ground. So what you want to do, you want to make sure your butt is back in the seat enough. Okay, and how you do it is you usually put your hands on the little grab bars here. And you want to start back and then propel forward. Okay, I know the locks are on. Okay, but since you don't have, so if you were a normal person, you would use both hands. But since you have an altered left upper extremity, you just want to make sure that you're left upper extremity would stay safe, and then you would steer with the other foot, but we'll pretend like you have full function.
Okay.
So here, let's unlock the brakes first. Other side too. There we go. And you're just going to propel forward. Take your time. Okay, and then how you turn is you bring this one back as you bring this one forward. Okay, so then let's go, let's face, or let's go back. Okay, good, and then lock your brakes again. Lock your brakes. You gotta make sure they lock. There you go. Okay, so what we're gonna do next, you're gonna go up the ramp, and how you're gonna do that is when you're going up, you're gonna lean your body slightly forward, and you're gonna use big thrusts to get up, okay? I'm gonna be right behind you, and if you need to take a break, you can always stop, hold onto your wheels, or also stop and put your brakes and take a break until you're ready to go up the rest of the way, okay? Okay, so unlock your brakes. Okay, and let's do big thrusts forward. Good, and then we can turn around here. Okay, stop for a second, and then when you go down the ramp, you're gonna make sure that you're keeping your hands kind of on the bars there. You want to make sure you don't go fast, so you're kind of just going to have the bar skim between so you have control instead of completely letting go, okay? So let's slowly go down and make sure you control it and don't drift over to the grass here. You want to lean back too. Good. Good. Now lock your brakes.
Okay.
Other side. Yeah. Okay. So since none of my family members feel comfortable doing a wheelie or a curb, I'm going to do it. So first, how you would typically approach a wheelchair with a wheelie to get on to the curb is you would start at a smaller step just to get some practice, but then you would kind of put yourself into a wheelie first and then put the front wheels on the curb, and then you would lean forward and simultaneously bring the wheels forward and go up onto the curb, and then to come down, if you were doing a wheelie, you would come close as you can, do a wheelie, and then come down slowly and then come forward. But as a caregiver, if you're getting somebody up a curb, I don't feel comfortable with my patients going like this at all, because then you're trying to lift like this and can really hurt the caregiver. So instead, I would teach them to do kind of like how you're doing the stairs. So you'd have them go into a wheelie position, and you can kind of use the curb as help to go into the wheelie, and then you would slowly push them like that until the wheels are like this. And instead of going forward like that, just because it can kind of hurt them, the caregivers at least, you would have them pop into a wheelie here, back up, and then slowly lower, in which the wheels can kind of create stability on the second curb, and then slowly come down here. Of course, you would lock the brakes. And there you go. Okay. So I just got to talk it out first, okay? So what we're going to do is we're going to go up the stairs. Usually you have the person in the chair, and I would prefer if they had like an attachable seat belt to the wheelchair just so they keep their hips back. As we're going up the stairs, we're going to tilt. We're going to have them help us tilt into a wheelie along with the second person. We're going to have good communication between the front spotter and the back spotter. Want to make sure you're lifting with your legs, and you want to make sure the patient's arms hold on. You want to make sure the patient's arms either stay within the wheelchair, especially since our patient has no use of her left upper extremity. But if they were fine, you would have them assist with the wheeling back. And of course, you want to go take it one step at a time. So what we do, so move back a little bit. We're going to push them into a wheelie first. You want to make sure the anti-tipping bars are off, which they are. They don't have any. Okay, you'll tip them into a wheelie. Okay, we're going to roll back. Bend at your knees more, Ma. Okay, you're going to stagger going up and bring them up. Good. Ready? 1 second. Ready? Stagger coming up and come up. Stagger coming up. Go up. Stagger coming up. Go up. Stagger coming up. Go up. You want to make sure that you clear the landing and put the wheels down. Okay, then going down, you're going to tilt again, so you want to make sure you go into a wheelie. Okay, the bottom person's going to stagger as well. Okay, we're going to go forward. Step down, mother. Okay, step down one more, I would say. Go down. Shouldn't be tilted that much. Go down like another. Okay, 1 second. Wait for me. And we're going to go down. Wait for me. Go down. Wait for me. Go down. Wait for me. Go down. Good. And slowly lower. Of course, if they're staying here, you lock the brakes.